Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and here's what I bring to you all from the world of medicine. Extreme heat exposure may trigger kidney disease flare-up. Researchers linked meteorological history in New York State with data from over 1.1 million emergency room visits during 2005 to 2013 and found higher emergency room visits for kidney-related problems such as acute kidney injury, kidney stones, and urinary tract infections during days with extreme heat exposure. Given the increasing frequency and intensity of extreme heat exposure due to climate change and the growing prevalence of kidney disease worldwide, researchers examined their association with one another. They examined the association between extreme heat exposure and kidney disease-related emergency department visits based on seasons and disease subtypes in New York State. In their paper published in the American Journal of Kidney Diseases, extreme heat exposure was significantly associated with an increased risk of ED visits for multiple types of kidney disease, mainly acute kidney injury, kidney stones, and UTIs. Furthermore, the impact of extreme heat exposure lasted a week and was stronger in the transitional months, that is May and September, than the summer months, that is June, July, and August. Glitazones linked to 22% reduced dementia risk according to a study. Use of an older class of type 2 diabetes drugs called glitazones, also known as thiazolidinediones or TZDs for short, is linked to a 22% reduced risk of dementia, reveals a long-term study published in the open access journal BMJ Open Diabetes Research and Care. Because type 2 diabetes and dementia share some of the same physiological patterns, researchers have started to look at whether diabetes drugs might also help stave off or treat dementia, but to date the findings have been inconsistent. For the study, the researchers compared dementia risk in older people with type 2 diabetes and treated with either a sulfonylurea or a TZD with those treated with metformin alone. They drew on the electronic health records of more than 5 lakhs people diagnosed with type 2 diabetes from the National Veteran Affairs or VA health system spanning the period from January 2000 to December 2019. Only older patients aged at least 60 and given a first prescription of metformin or a sulfonylurea or a TZD between January 2001 and December 2017 were included in the study. Their health was tracked for an average of nearly 8 years. After at least 1 year of drug treatment, use of a TZD alone was associated with a 22% lower risk of dementia from any cause, compared with the use of metformin alone. Specifically, it was associated with an 11% lower risk of Alzheimer's disease and a 57% lower risk of vascular dementia. While the risk of dementia from any cause was 11% lower from the use of metformin and TZD combined, it was 12% higher for the use of a sulfonylurea drug alone, prompting the researchers to suggest that supplementing a sulfonylurea with either metformin or a TZD may partially offset these effects. Further in-depth analysis indicated that those younger than 75 benefited more from a TZD than older patients, highlighting the importance of early prevention for dementia, noted the researchers. And these drugs also seem to be more protective in overweight or obese patients. 2 antiseptics work equally well to prevent infections after fracture surgery. A randomized clinical trial involving more than 1,600 patients with open fractures found that orthopedic surgeons could select either of the 2 solutions, that is aqueous 10% povidone iodine or aqueous 4% chlorhexidine gluconate for infection prevention. The study, called Aqueous PrEP, was published in The Lancet. Study participants were enrolled from a total of 14 hospitals, including the University of Maryland Medical Center or UMMC, as well as other facilities in the US, Canada, and Spain. To conduct the trial, the researchers recruited patients with open fractures that required surgery at the 14 participating hospitals. Each hospital was randomly assigned to use one of the antiseptic formulations at the beginning of the 3-year trial. Then, each hospital alternated between the solutions every 2 months. This unique study design, known as multiple period cluster randomized crossover trial, ensured that all the hospitals used both formulations equally and controlled for variations among hospitals that could have also affected post-surgical infection rates. Aqueous PrEP is one of the 2 trials being led by Dr. Slobogian and colleagues that are aimed at closing gaps in the medical literature on the most effective infection control techniques in orthopedic surgery. The study designs follow a master protocol called PrEP-IT, or Program of Randomized Trials to evaluate preoperative antiseptic skin solutions in orthopedic trauma to test infection prevention techniques in trials that will provide crucial evidence to help guide surgical practices. The second study, called PREPARE, will evaluate the use of 2 alcohol-based antiseptic skin preparations in surgical patients with both open and closed lower extremity fractures. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.